Welcome back, everyone. A new study is shedding more light on early onset gastrointestinal cancer cases around the world, finding that not only are GI cancers in people younger than 50 going up globally, they're the most rapidly increasing early onset cancer in the U.S. And here with us this afternoon with more on the study is Dr. Thiru Lakshman, a colorectal surgeon at St. David's North Austin Medical Center. Thank you so much for being with us today.
Thank you for having me.
Well, first, let's talk a little bit about this new study and what you're seeing in regards to your patients.
Sure. So this was a nice new review article came out from this past month's JAMA, Journal of American Medical Association, and it was basically looking a review globally about the incidence of GI cancers, particularly in what they call early onset. So that means technically anyone under the age of 50. GI cancers, like we were talking about before, is a very broad category. And basically that's anything from the stomach, the large intestine or the colon, the pancreas, the esophagus. This is the whole envelope of the category of GI malignancies or cancers. They looked at a review globally in 2022 of all these cancers, and they saw a significant increase in these people under the age of 50. Globally, about 184,000 new colorectal cancers were diagnosed in people under the age of 50. And, for us here in the United States, almost over 20,000 of those were just in the United States alone. And even in some of these other cancers, not quite as the same, numbers as colorectal cancer, but those are all increasing in younger people as well.
Well, is there any possible cause for this increase?
Yeah, that's the million-dollar question, and they're not really sure. There's not one specific thing that they know of. There's a lot of studies going into this, and this has actually been talked about for the past few years that we're seeing these increased numbers, particularly in colorectal cancer. And we can't find one specific thing. I think there's a number of things. I think a good way to look at it is modifiable risk factors and non-modifiable, things that are within our control and not within our control, and how these things can affect it. So we know that poor diet, high-fat foods, very ultra-processed foods, smoked meats, things like that, excessive alcohol, smoking use, all of those things, a sedentary lifestyle, all those things that we know are associated with increased risks of GI malignancies. And then there's other things that are out of our control, family history, genetic mutations, having other diseases that are linked with it, like inflammatory bowel disease. Those are other risk factors that we can't quite control.
So if a younger person is diagnosed with a GI cancer, what's the survivability rates of this kind of cancer?
Yeah, it varies significantly based on the type of GI cancer. Again, this is a broad spectrum I'm talking about, from colorectal to pancreatic to stomach. Some of these, like pancreatic, stomach cancer, they're very aggressive and quite poor prognosis, even when found in early stage. Colorectal cancer is one of the GI cancers that, when found early, is very treatable. In fact, stage 1 and stage 2 is effectively curable at very high rates. So the real key here is prevention and screening to find it early, because when found early, sometimes you can even prevent it, finding it as a precancerous polyp during a colonoscopy or a very early stage cancer, and then it's very high cure rates. As it progresses, those cure rates drop significantly.
So what's your advice, especially to younger people, when it comes to finding GI cancers and getting treatment? For
sure, good question. So, and I'll just tell you anecdotally, I'm seeing it myself here in Austin in my own patient population. I mean, at least half of my patients that are getting diagnosed with colorectal cancer are under the age of 50. So it's a real thing. We're seeing it here, in real life here in Austin. So I think the important thing is to listen to your body. If you're noticing unusual symptoms, changes in bowel habits, blood in your stools, weight loss, fatigue, things that are unusual, that are persistent, go and see your doctor. Get screened. Screening, particularly for colorectal cancer, is the best thing. So if you're of the age, 45 now is the screening age for colonoscopies, talk to your doctor, get referred and get a colonoscopy done. And don't ignore the symptoms, I think. And then healthy lifestyle. Watch what you're eating, try to be active, exercising, other things in moderation.
All good advice. Doctor, thank you so much for joining us this afternoon. We really appreciate it.
Thanks for having me.